everyone. Hope you're all doing good. Guys, this is Dr. Sowmya here. Today I have come up with a very new topic, interesting one, which is a risk management for MRCPIOSCE. Definitely in OMR series, we are trying to help you with various tasks which you could come across in the exams, particularly pertaining to risk management. In MRCPIOSCE, they do not ask completely to do an audit or a root cause analysis. It could be just a part of the task, whether patient simulated or a structured discussions. Okay. So to start with, please remember, enjoy the journey and be kind to yourself. MRCPIOSCE exam is a very doable exam. And today I have Dr. Chitra here to help me as a role player. Thank you, Chitra, for giving me your time. So thank you so much.
Thank you.
Thank you. So guys, I'm going to show you the task and then we will start after showing the task. Okay, Chitra, let's start. Yeah. Hello, I'm Dr. Sowmya, one of the doctors in the clinic today. Can I confirm your name and age?
Yeah, I'm Ruby, 32 years old.
Okay, Ruby, first of all, I want to apologize. I'm meeting you on behalf of my consultant, as my consultant is stuck in an emergency. And actually, I have gone through your notes. So I just want, if it's okay, I would like to ask you a few questions as we are meeting for the first time. Is that okay for you?
Yeah, okay. That's fine.
Okay. Ruby, could you please tell me, I'm aware that your stitches are painful and you have some funny discharge as well. So could you please take me through what's happening?
Yeah, actually, this is my first delivery and I was really hoping, that I'll have a natural birth. So I delivered normally, but they told me at the last minute that I would be needing a cut down below. And then it was, they stitched me up again. And the last 3 or 4 days have been really bad because I think the stitches, what they put, they have just broken down and there is some dirty smell that is there. I'm not feeling so good. I have fever. So I really don't know what's happening. This is not what I expected.
Okay. I'm really sorry for what you are going through. I can see you are really going through a tough time and I'm here to help you as well. As of now, do you need any pain relief to help you better?
No, I think I'm okay.
Okay, Ruby, I understand that you had a normal delivery followed by which you have this pain. So did the pain start immediately or after you, because we would have given you the pain relief. So I want to know a bit about when did the pain start and when did the discharge start?
It started maybe around 3 to 4 days ago, the pain, and the discharge was a little before that, I could say. 4 to 5 days.
And you said you have fever, right?
Yeah.
Okay. So have you taken any paracetamol or anything for the fever?
I had one tablet left with me, so that's what I've taken.
Okay. And Ruby, have you named the baby? How is it going with the baby as well?
Yeah, the baby, she's fine. I named her Sarah.
Okay, that's a very cute name. And are you breastfeeding Sarah as well?
Yeah.
Okay. Do you have any pain in the breast?
No, that is fine.
Any bleeding at all?
No.
Okay. Are you generally fit and fine?
Yeah, I was fine in my pregnancy. Before that, everything was fine.
Okay. Do you have any allergies?
No, not that I know of.
Okay. Any other operation on tummy or pelvis?
No.
Okay. And how is the support at home?
Yeah, I'm well supported. My husband is a very nice person.
Okay, fantastic. That's really good to know. And how are you coping up with all this? I know this could be definitely stressful, apart from handling your baby, and there are a lot of changes which you will be going through. So how are you coping up?
Yeah, I'm not doing well at all. So that is why, I just walked in today to the hospital.
Okay, and have you shown to the midwife or the GP, anybody else?
I went to the GP. But he said, it's fine. This is what you expected. But I was not happy with what he said. So I just came here.
Okay, thank you, Ruby, for giving me so much of information. I'm just going through a quick recap to understand what exactly we have chatted so far. So this is your first pregnancy and you had a delivery 5 days back, which was normal and you were fine, but it all started with the pain and a fishy, funny smelling discharge. You have taken paracetamol and Sarah is doing well and you're breastfeeding. Apart from this, you are fit and fine and no allergies. And it is getting a little difficult to manage, correct? Yes.
Yeah, that's right.
Okay. Ruby, for one thing which I want to do is I would want to take your observations. I would want to, you said you had fever, so need to check your temperature, as well as I need to check how is the stitches there down there. So if it is okay, I will be examining you with your consent and in front of a chaperone, if that's okay.
Yeah, that's fine. That's fine.
Yeah. Okay, so the examiner will be giving the findings. Okay, so Ruby, I am just going through the observations and the examination, what we did. So your blood pressures and your womb is well contracted. So you have a mild temperature, as you rightly said. But there is one thing which I would want to tell you, that the stitches which we had put, okay, so it seems that it has given away.
Oh, really?
Yes.
Is that normal? Is it expected to happen?
Actually, Ruby, I know this is an unexpected one for you. However, generally, the healing depends on a lot of other things. So we need to look why the stitches, generally, it doesn't give away the way it has here. So there is an element of infection for sure. Okay. So as you said that there was no problem during the delivery, during the pregnancy, everything went well. So we need to see the source of the infection. Okay. So what I'm going to do is I'm going to take a couple of tests with your permission. Like we need to take a swab of the discharge to see what type of bug which is affecting you, as well as I need to send some blood test like the blood counts and also the lactate levels to see if you have any serious infections. Okay. Because, and along with that, few blood tests to help me to understand what's happening, as well as probably we would arrange an ultrasound as well to see if the womb, any collection inside as well. Okay. And as well, I will be putting you in touch with my consultant as well. So if all the blood tests comes normal as well, we need to be starting you off with the antibiotics, because we need to make sure that whatever the infection which has started off, we need to make sure that it is well controlled. And once the infection starts getting controlled, then the wound, which is the stitches which has given away, it would start healing on its own.
I hope it's safe for the baby because I'm breastfeeding.
Yes, Ruby, your concerns are valid. Definitely, these are something which are safe for the baby, and we will be giving the antibiotics or the medicines which are safe for you and the baby. Okay, there are a couple of things which you need to be knowing. So we will be actually giving you an information of how to keep the personal hygiene, how to clean that area as well. Okay, so ideally, it's once the blood test, everything comes up, if there is an element of infection, you would need to be getting admitted. If not, we can treat you on an outpatient basis, depends upon the blood results.
And how long would that be? Because
see, the antibiotics we need to be giving to you by 7 to 10 days, depends upon your blood and urine, this one as well, results as well. And generally, once the infection subsides, it starts healing on its own. But there are some women who ask for restitching of this, or we might have to be doing this restitch again. However, the most important thing is the time period. We might have to be allowing around 2 to 3 months for this to heal. Okay, so then only we'll be able to restitch back. It wouldn't be any time earlier, because if there is an infection, there is no point doing it earlier.
Okay. But I hope in the long term, it will not affect me.
Yes, generally, if the healing happens by itself, the stitches, whatever is required would be less. However, there could be a bit of scarring. There could be a bit of probably pain initially when you resume the sex. That is something which you can encounter. But as the healing process happens, we would be able to help you with the lubricants and the jellies as such. And if at all, if there is any pain in the scar, we can discuss after the healing process what we can do for that as
well. Okay.
Okay. Any other questions you have in mind?
Yeah, what about my future birth? Like if I'm planning a future pregnancy, will that be affected or?
Yes, generally it is, unless it is something which can be a recurrent factor, because some women can have allergy to the suture materials also. If something like that is identified, we can prevent them. But generally if there is no factors we can find out, the chance of it having is definitely there, but it won't be, that risk won't be higher. And we would be helping you during the pregnancy also to keep that area healthy, safe. And if at all, if there is any element which can increase your infections, we would be talking to you immediately to you as well. Okay. And to tell you all these things we take very seriously, Ruby, and there will be an incident report which would be raised to understand what happened, and there would be a thorough investigations. And once that we have a reason, if we have anything error from our side, this would be discussed with you by my consultant. Okay. So and also I have given you a lot of information. So the first thing what I would be doing is I will be sending you for the investigations, make sure that you are safe. And meanwhile, if everything goes well, then you can go back home. Otherwise, you might need to be staying here based on the results. And I will be putting you in touch with my consultant, and I'll provide the information leaflets as well, which could be helpful.
Okay.
Yeah. Okay. Thank you. Yes,
Thank you.
Chitra, I think you're a very, very soft role player. You are somebody who was not getting angry, but they could get angry. Thank you. So any feedback you have for me?
No, I think you dealt with it really nicely. Like the infection part, and the explanation was also very nice.
Okay, thank you. So guys, this could be, they would definitely ask whether I can complain or not. So if that is asked, you can always say, unless she tells that I would want to complain, I won't be telling, please go ahead and complain. Okay. So if she says, you must be saying, yes, this is your right. You can go ahead and complain. However, what I would do is I will be calling the complaint manager who can sit with you and take you through the whole of the process, so that there will be, once you complain, you will have within 5 working days, you would get an acknowledgement, and ideally within 20 working days, you should be getting an answer. This I'm telling you the rough timelines with which it works. Okay. And as well, so few things which you must be, as I said, incident reporting. So that's what I said to her, that these things are taken seriously and we would be evaluating. If any error, we would be letting you know. Not necessary that we had any problems, because she was somebody who was a low risk. It can happen still to them, right? So you are supposed to be looking into that. And this is an perineal wound dehiscence, because there was a complete breakdown. So you definitely let it to heal on its own, and then you take it from there. And a template just to understand how to go about. These tasks are based on communication. Now, if it is an angry patient, please remember to acknowledge it, that I can see you are angry. I can see you are upset. But you have to apologize only once. Only once you will say that I'm sorry. Rest of the times you would say that, okay, I can see you are upset. I can see you are angry. Okay. And stay calm. Don't be defensive. And you can say that, yes, that could have happened. However, we need to look into the reasons. And generally, for all other cases, they generally ask you, tell me the risk management. So the first and foremost thing, if it's a structured discussion, you can say about the documentation, which you do for everybody, debriefing the patient with duty of candor, that is being plain and honest, debriefing for the team in case of shoulder dystocia, in case of ureteric injury, in case of bladder injury. Incident reporting, there is a huge list, guys, from mother to the baby to the organizational level. For example, missing an instrument which you wanted, it is not in the trolley. That's an incident reporting. Or doing a procedure which has been taken. For example, you are doing some of the procedure along with the Mirena insertion. You forgot to insert the Mirena. That's again incident reporting. There is a list. Please go through that. Okay. And anything written to the theater. Okay, so those things you need to be knowing. And as well, the one more thing which I want to say is Jehovah's Witness. Anybody who is going to the theater, anybody who is returned to the theater due to complication, or you're taking a consent, always ask whether you have any reservations for the blood or the blood products. If she's a Jehovah's Witness, few things to ask, few things to understand. You should check whether advance directive is there or not. Second thing, there should be a team including Jehovah's Witness advocate as well as the specialist nurse. Third thing, you need to remember that they are not happy to take any blood and blood products from anybody else. But there could be a couple of blood products which they could be taking. So you need to know that. The last one is, you need to tell her anytime if she changes her mind, she can let you know. This could be in previous cesarean section with placenta accreta. This could be somebody who has a problem whom you are returning to theater, somebody who is here for hysterectomy, all those things. And remember, intraoperative cell salvage technician should be there. Okay, those a bit about Jehovah's Witness advocate. Then you have two important things. One is root cause analysis, the other one audit. I haven't seen so far giving a full case. Root cause analysis says there is one problem which has happened. For example, after your incident reporting, if it is a serious injury, for example, retained swab, sepsis, they had to return to the theater. Then you do a root cause analysis, like you collect the statement of the people, you compare with the actual case sheet, and you assess the problems in terms of fishbone model, okay, like the patient factors, organizational factors, all those things. So, and then you come to the conclusion. That is the root cause analysis. Audit is when too many cases are happening, too many vesicovaginal fistulas, too many ureteric injuries, too many bladder injuries, then you do an audit. Basically, one case you do root cause analysis, too many cases you do audit. So if you mention these things, okay, that would be really, really helpful during the exams, because with the structure discussion, long case, short case, they are asking now, tell me any risk management problems or any clinical governance issues. Okay, so if you cover these either in patient simulated or structure discussion, I'm sure you would be able to score the mark and get your boxes ticked. Hope this was useful. Just remember to remain calm. Focus on common things and you will definitely win. All the best. Thank you so much. If you haven't subscribed our channel, please go ahead and subscribe. And thank you everybody once again and all the very best. Thank you.